Thanks everybody for joining. We are here on September 17th. It is a Wednesday, and this is a special celebration, if you will, of someone who has been in our group for many, many years. And I've asked Dr. Charlie Sand to talk to us today about advocacy. Why is it important currently today? Because what we've recognized is that if you want to make big change in anything that you do, yes, you could start locally, grassroots, but if you want that change to be bigger, everlasting, then you really have to go and advocate for it at the legislature. There's no better person to talk about that than Dr. Sand, because as he'll go through today, I've asked him to talk about the many years of advocacy, which not many people, I don't think, know the story about how we have ended up today with several laws that have been passed for stroke care in the state of Florida. We now have a Florida Stroke Registry. And it all started many, many years ago with Dr. Sands, who said, let's see if we can push this a little bit uphill and actually get this thing into law. And why, and that's just a foundation for what we're trying to do here in Florida, thanks to people like Ken Schepke, Steve McCoy, Dr. Pepe, and many others who are trying to get whole blood, or blood products, I should say, into the pre-hospital environment. And the only way we're going to do that is by, quote unquote, going to Tallahassee. So Dr. Sand, thank you for joining us. Would love to hear a little bit of your history, some about the stroke story and the stroke journey, and then we can parlay that into moving forward, looking forward into blood products through advocacy, and how we can reshape the future of not just trauma, but medical hemorrhage in the state of Florida. So Dr. Sand, take it away.
Thank you, Peter. It's great to be on. I love watching your every Friday lectures and just relaxing, not having to do these lectures like I used to all the time. But I appreciate it. And as Peter said, this is great because I never have been asked to do this kind of lecture before. In all honesty, I just do it. I just don't tell anyone I do it. I just do it. And I've done it for years. And I'm glad to be able to, as Peter asked me, he really said, talk about how we can advocate for, in this case, a grant money for the blood products in EMS. But really what I want you to do, Charlie, is tell your story so you can mentor others. And that's what I hope to do. And it's not a one-shot deal. I'm always available for anyone who has questions. So that's what you're going to get the most flavor of. And I'll keep throwing in blood stuff in here. So okay, let me see. Okay, there we go. Okay, so I'd like to thank all these, let me just see. Yeah. So these are all the people I thank for helping me put this lecture together. So I can't thank them enough. Plus, I'm sure I left people off and I apologize, but those are the key players I talked to, and they kindly give their time to me. So here's my disclaimer. I don't get squat for this beautiful state of Florida for this bloody lecture. Maybe I should have been smarter and worked for pay in the Everglades. So what I'm going to do is talk about advocacy. Primary reason I was pulled out of retirement to do this. I was voluntold by Peter, Paul, and Kenny to do this for the reasons I mentioned, to hopefully mentor others to do this. And of course, Angus is always hanging around, get me to do stuff when he can. And if he keeps saying if he had a hammer and something about a nail and something like that. I don't know what he's talking about. Okay, so to mentor others on my lucky and blessed advocacy history, let me just get this off because this is in the way. And I apologize. Let me. Oh, there we go. Okay, we'll get it. The right place, right time, right luck, which a lot of it's been, the right people and the right reasons. So there's Peter, Paul, and Kenny. And so here's a detailed recipe for successfully obtaining a legislative grant or getting a law passed, or the generic recipe for doing political advocacy. So if you want to know that, just go to ChatGPT if you trust it. Just go there, or you can ask the good doctor how to pass medical legislation, or how to obtain a grant for blood products through Florida legislation, how to get a law passed in Florida legislation for blood product delivery. That'll give you much more information than I'm going to give you today. So if that's what you want, just go to one of those sources. And I keep having trouble. Okay, I'll just click on this. So we're going to take a walk down my memory lane. There's where it started. My parents, my two sisters, and then my immediate family now, of course, at the beach since we live in Tampa Bay. And I grew up in a sleepy little town in Miami, which really was great and wonderful in the 60s and 70s. Absolute beautiful paradise place, which I feel about Tampa now. I was lucky enough in 1972 to obtain Eagle Scout, and I should have felt, and I didn't steal it from you, Paul, the Forrest Gump story. I should have felt there was some Forrest Gump in my life when I set a national record and with a month to go became an Eagle Scout at 13, which at that time was a national record. So I should have had a hint. Someone keeps moving me to these positions, and just some pretty good accomplishments. And there's Forrest. There's where I went to high school in Miami, for those who on the call are from Miami. And I went to college at the Swamp. Hopefully they'll turn their season around soon. And there's the best thing I got out of University of Florida. I met my wife, who's without her support, I never could have done everything I'd done. So we're a little over 40 years now. Oh, notice how I politically correctly just call it the Gulf. I'll leave it at that. And there's college. That's at, for those who went to Florida, that's at Brandywine Apartments. And I was lucky enough to go to med school at Miami, and it was just a phenomenal experience to return to Miami where I grew up, and I was honored to be able to go there. And that's really Jackson Memorial and the ER just solidified what I wanted to do with my life in emergency care. Then I could have stayed, let's go back there. I could have stayed at Miami. I was advised remember, they did not have an emergency med program back in 1985. And I'm not looking at the chat, Peter. I'm going to depend on you to do that in case something comes up. But I was advised everyone burns out in emergency medicine. You need to have a backup. Just do internal med first. So we have a good internal med program here at Miami, but I knew I liked cardiac disease at the time. So I was told the best place to go, at least in the Southeast, was up at Emory, where J. Willis Hurst, who wrote the book The Heart, was President Johnson's personal physician. That's Lady Bird. And I was a recipient of just incredible teaching for that first year. And those who went to the Emory system and under Hurst know my joke about vector analysis. Didn't matter what the EKG showed, didn't matter if it was a STEMI, what's the vector show? And that was his thing. A guy named Andreas Grunzik, preparing to live stream. Is that live streaming, Peter? Okay. I'm saying, I don't know if I'm frozen or not.
No, Charlie, just ignore that.
Okay, I'm sorry. I want to make sure I wasn't talking to a blank screen. So another, again, with these Forrest Gump moments, this is the guy who invented angioplasty. Emory stole him from Sweden. I don't know how much they paid him to do it. And I was lucky enough to, a month before he died, to actually interact with him at Emory. And actually the cool Grunzik story, and he had his own cardiac cath to show he was a proponent for it, as you can see on the table there. And I was lucky enough to be in an elevator with him. This is where I started getting introduced over and over to visionaries and trying to learn how to do that process and being lucky enough to do it. In an elevator with 4 other cardiologists. I was the intern. I went in a corner to stay out of everyone's way. And he made the statement, which I'll never forget. He said, the way we can stomp out cardiac disease is do a cardiac cath on everybody at age 40. You got to think about the time, 1985, there was no CT coronary, nuclear scans were just beginning, so there weren't many tests to do to assess for coronary disease. So I thought that was pretty profound at the time. I don't think we need to do it now, but that was a good idea. And then a month later, he and his wife, a radiologist, went up into a storm in his private plane and they crashed and died. So a tragic story, but you can look him up and you'll see that story. But that was a month before he died. I had that interaction with him. Okay, I'm gonna have to do it by this. The next person, again, just Forrest Gump, like I spent a month in the CCU at Grady under Nanette Wenger, probably one, if not one of the most famous women physicians, but certainly women cardiologists. You can see all the great things she did. And she was just such a kind person. You just learn I don't know how to say it. I learned by osmosis from all these people. Keith Wren in the ER was just, may rest in peace, was just an incredible teacher. He taught me the art of debate. We would debate things right and left. He would debate with everybody, but it was good debates. He didn't believe in statins. Again, a Forrest Gump moment. I remember we debated statins when they first came out. He said nobody should be on statins. They don't work. I'll leave it at that. So I guess he wasn't right on everything. Then Corey Slovis was the chair of our ER at Grady. And so I did my 3 years internal med there. I knew I wanted to go back and do emergency med. I needed a break between the two residencies. So what did I do? I was on faculty in the ER with Corey Slovis. So I can't tell you how much I learned in that year, but Corey made each faculty do a research. And no offense to all the great researchers out there on this call, I have no interest in doing research, but I was made to do research. And it turned out to be a landmark study because it wasn't really, it was a case report, seven patients. We gave esmolol, cocaine, ran in the middle of the night to Grady, checked vital signs, but two went into hypertensive crisis, paradoxical, because the unopposed alpha. That's when you use not to use beta blockers on cocaine. And it's been quoted in every ACLS book and numerous times with citations, but I was made to do that study and it was a landmark study. So I appreciate Corey and Keith and Steve Brody for making me do that. Andre Churchwell, you can see all the great things he did. The Churchwell brothers, the other brothers up at Yale, and this one's at Vanderbilt, and he was my chief resident in my first year. And again, the kindest person who did nothing but teach, great teaching. So again, Forrest Gump, I'm the recipient of incredible people who are visionaries. Michael Frankel was involved in the NINS trial for TPA that got FDA approval, the Dawn trial that extended the interventional window to 24 hours. Did lots of good stuff. First one in a hospital to have 24-hour round-the-clock stroke teams. He was the first to do it in the Southeast. Well, he happened to be my intern when I was a second-year resident. So whenever I'd lecture with him, I always joked that I taught him all the good stuff he knows. So it's just a running joke we've had back in the days when I was lecturing on the circuit on stroke with him. So Corey, everybody knows the 5 things. Everything comes down to 5. So that's how we're going to do it today. So the 5 takeaways. Here's what we're going to do. We're going to talk about we're going to hit the conclusion first. If you want to break after that, go to lunch, you can. Advocacy roadmap, the SAND roadmap to advocacy success. Reinforce the conclusion. The 5 takeaway points again, we're going to reinforce it. And then the others can pipe in and we'll have discussion Q&A. Hopefully we have time. Keep in mind in the rule of 5s, you have 2 hands, so there can be 2 sets of 5. And that's what I do a lot. So here's the 5 takeaway points. Individual advocacy, personal advocacy efforts are vital. We're going to go over all these in detail. Collective advocacy, strength in numbers. That's going to be important for you guys with the blood grant, trying to get the grant, pass through legislation. Media advocacy, when people lead, politicians will follow. Do your homework, frame a strategically concise message, show respect and thank them. State and local officials work under a different operational paradigm. Learn the differences and how to maneuver through the bureaucracy. You will not figure this out on your own. You have to have people teach you. So get your mentors for that. Where was I? Oh, basic steps that you can do. Be prepared, be prepared, be prepared. Get involved for the right reasons. If this is not for you, support those who desire and have an aptitude to do it. That's an important concept. This is not for everybody. When offered a window of opportunity, say yes within reason as many times as you can. That was my story. Said yes to everything. I was on every committee and I just luckily moved up the ladder. Be willing to take strategic risk, weighing the benefits and the risk, spread the credit for your successes, celebrate any success, no matter how small. That's that positive attitude you want to spread. Constantly make collaborative friends along your advocacy path. And I can't tell you, like everybody on this call, I'm sure, how many friends I have made and colleagues and in collaboration with everybody. Healthcare is shaped by politics at every level. Practice advocacy the same way you practice emergency medicine. Always tell the truth. Always act in the patient's and your state's and nation's best interest. People will notice if you don't do that, at least definitely in the political arena. Above all, do no harm. So we're hitting the SAND roadmap to success. And believe it or not, there was really a movie in 1972 by this name. It was a scary movie too. Don't look at it if you don't like horror features. And again, this is my life, Forrest Gump, or it can be serendipity, or it can just be something keeps moving around like a pawn my whole life. So this I've noticed, like many of us, I'll say, because I've noticed the same trait in great leaders, but especially from EMS and the emergency department, is the craziness. I call it the craziness, but people notice it. It's really passion, dedication, and enthusiasm for the greater good of humanity. Trust me when I say people notice that. Politicians notice that. Mentors notice that, and they will reciprocate likewise. This sand robot has grabbed the attention of many mentors and politicians as resulted in their eagerness and enthusiasm to collaborate for a common cause. And by a blessed stroke of luck, this has just keeps happening over and over. These landmark and groundbreaking accomplishments, again, that I've been part of great teams, whatever you want to call it. Forrest Gump, serendipity, head of the hand of God moving me around. Advocacy roadmap. Your personal efforts are vital to communicate the value of trauma and emergency care, because we're talking about the blood and EMS, to elected officials and the public. Speak up, show up, and write. Relationships do matter. And that's when early 2000s, when I was first got on the Florida American Heart Association Board of Directors. That's John Brennan. Can you see my arrow? Is that pointing an arrow, Peter? Is that okay? Okay.
Yeah.
That's John Brennan, CEO of Heart at the time. That's yours truly, and that's for those who know up in Bayonet Point, Raul Musanero, a well-known cardiologist, very politically active. And I learned a heck of a lot from all those guys. There's strength in numbers. Strength in numbers, that's why we're here. We're far more effective working together than apart. Relationships do matter. Again, strength in numbers. What we used to do with American Heart, they don't do it anymore for a lot of reasons, including it's no longer a Florida, Puerto Rico affiliate. It's now Southeast United States. So that's good and bad. You consolidate services, but you dilute out things. But when we were the Florida entity, I was lucky enough to be part of, we always get every year about 100 people would go to Heart on the Hill and advocate for what we're trying to advocate for. And in this case, we were doing AEDs at this point in 2005, putting them on law enforcement, giving protection. That was the head of law enforcement. That was the CEO of Subway for Florida. So we got a lot of good free subs. It was delicious. That's a guy named Gus Bilirakis right there. So his name's going to keep coming up. But he was a huge supporter when he was part of Tallahassee before he went to Congress, which he's in now. The media advocacy, traditional and increasingly new social media, I'm talking about, reaches huge masses, especially social media. When the people lead, the politicians will follow. And this is key. If you're going to do this stuff, get formal media training, or at least seek the advice of others, their experience. Wherever I'd go, I'd always say, who's your media person? And I'd always get feedback. And how'd I do? How can I get better? I took courses. I talked to the fire rescue media people, for lack of better words, anyone I could talk to get better. And that's what you need to do if you're going to do this stuff. Relationships do matter. That's just one of many things. Notice what I'm doing with my hands. All these things were not DNA driven. These are learned behaviors that people taught me to do. So, and you see it with politicians. I just look at any politician, you'll see them do this stuff. Okay, so the 12 rules, which is 5 + 5 + 2, for effective advocacy. And just don't mix your message to the politicians. There's a good message and a bad message. The one on the left's a good message, the one on the bad's a bad one. Be prepared for the bureaucratic political maze. Keep in mind, you guys, I know I'm speeding through this. It's being recorded. You can watch it slow at a later time. There's a political maze. You got to learn how to move through it. I like to liken it. This is what I say over and over. It's getting through the many bureaucratic bowel and obstructions in the political system, and including maneuvering around some who are anuses. I'll leave it at that. But you got to learn to maneuver around everyone. This isn't just politics. This is life. I don't have to tell you. You got to have a thick skin, and I think we all do in EMS and the emergency department, but you got to have it in politics too. You're not going to like some of the stuff you're going to see. Most legislators, so constituent contact matters. Most legislators get little or no guidance from their constituents. Believe it or not everybody talks to them. You can make a difference by speaking up and meeting with them. And for most, if you're not one of their voting constituents or you don't give a lot of money, you don't matter. And that's reality. Just understand that. That's why it's important. If you're in Broward County, you want to talk to your Broward legislators about the blood advocacy that we're doing here in the grant. You want to talk to your own specific because you're a voting member. They want to be reelected. You do matter to them, unless you donate a bunch of money. Then doesn't matter where you. And Elon Musk is the classic example with the last election, that he was not. Well, I'll leave it at that. He was not a Mar-a-Lago person, but he donated a bunch of money and he was awfully powerful for a little bit there. Okay, I guess I got to do this. You know how to make, okay, you can beat the lobbyists. You're going to be very frustrated. The lobbyists are paid. They're very good. They know stuff better than you do, except you have your strengths. You know how to make your case. You have personal, professional, organization credibility with the legislator. You can build over time a strong relationship based on trust and respect. And that's what I've done after all these years, and other people on this call have done too. Okay, communication is vital with a concise, focused message. Face to face is best, especially at the Capitol. Virtual's next, then phone, then email. Letters you can try to write, but I'm telling you right now, the internal look at it, and they'll either take it home for their collection or they'll throw it in the trash can. It'll never make it to the legislator. So face to face is the best. Any contact's better than none. And this is key, that last point. An off-season visit is very valuable. Go to their local office when they're not in session, like now. And Peter will, and everybody, and Ken and Paul will organize everybody, I'm sure, to strategically, these are the bullet points. Go now before session starts in January, whenever it's going to start. It's very valuable. Their local office, invite them to your hospital, your ED, your EMS, your helicopter, your EMS training program. You want to get them out there, and they will feed off the contagious excitement. I mean, everywhere I've been, it's exciting. People want to do good. They'll feed off that, and then they will listen to you more when it's time to hopefully have some impact. Okay, know who you're talking to. Learn about the person you're doing. Do your research. And that was a lot harder in the old days. I had to go through people to find out about people. Now you just go on the internet. Now, whether the information's accurate or not is another story, but find out everything you can. If they find they're a dog lover, heck, bring your dog to their office and say, sorry, I couldn't find a place for Spot today. And but you can pet them if you want. So, you can do all these little tricks to push buttons that it's not tricks. It's just human compassion and relationships. What is it he or she cares about and why? Treat everyone with the utmost respect, because you don't really know with whom you're going to be dealing. Aides, administrators, staff, family, good friends. I put this picture so I could walk into the senator's office and say, hey, lady, can you get out of here? I'm here to see the senator. It turns out it's the senator's mother. So, and you have no chance if that happens. So there's many examples. Just treat the secretary is probably the most valuable person. So you don't want to piss them off. Be courteous to everybody is bottom line. Treat everyone as you want to be treated, as they say. Do your homework. Consider legislative perspective and frame your concise message accordingly. Explain why it should matter to them, not why it matters to you. Okay, you can go in there asking for money, but not because you want to make more money as a physician or EMS or whatever. You want to do it to help the greater good of everybody and their constituents who will revote them in. You got to get that message down. There's show respect, good and bad karma resurfaces. Legislators and officials deserve to be treated with respect. Always thank them repeatedly. Any window of opportunity. Whenever I go, I see a senator or legislator in the grocery store. Thank you, legislator, for supporting our cause, or thank you. I know you're into this blood on EMS. We can't thank you enough. Do you want any more info? I do it everywhere. So that's what you got to do. Never ever scold or berate or embarrass a legislator for disagreeing with you, because they're going to remember how you treated them. Quickly get right to the point. Legislators are busy people. The rule of 5 is good. Corey Slovis is 5-5-5. You got 5 minutes. Introduce, talk about dogs, talk about family. That's 1 minute. Get your background message with blood and how it's going to save lives and limbs and all that kind of stuff. Then get to what you want, the grant money. That's what you want. You got to get that down in 5 minutes or less, because I tell you right now, at 5 minutes, you haven't done this stuff. At 5 minutes, they're going to get a call from their secretary and say, sorry, Senator, you got another call coming in, and you're done. You just blew it. So can't say, you got to have that concise soundbite, whatever you want to call it. You got to have that message. Just as you would if you're an emergency physician calling a consultant, EMS, giving a report, calling medical control, a dispatcher, providing life-saving instructions to patients, conveying information to EMS providers. It's all the same. You've got that concise, valuable message. Same with politicians. Don't be condescending. Remember to make your ask. I don't know how many times I've been in a room and I see all this social stuff and talking about this and that, and it's time to, and they forget to do the ask, and you blew it. Make it real, a compelling story. Stories. Start collecting your stories now. Write them down. Get the people. That can make the difference in a yes or no vote. What I always here's my message. I've just done it so many times, and I know a lot of you do because I've heard you say it. The life you save may be your neighbor, your friends, your family, or yourself someday. I say that over and over every time. I say that. I say it on other avenues too. Who can argue that message? There's nobody that can argue that. And tell your stories. This is just one example. Here's a guy had a stroke. We pulled out our interventionist at St. Joe's pulled out a big clot, and then he's dancing around. I can show you that, but I'm not gonna. Turns out this kid, a really nice kid, his son turns out to be a pediatric resident at Johns Hopkins in Maryland. So you never know who you're dealing with. So it just shows all these things are hit, the points I'm making, but tell your stories. Okay. The need for pre-hospital blood can come unexpectedly, but immediate use can make a life or limb saving. I think with this message on pre-hospital blood, life is important, but I think limbs equal, if not more so, because I hate to say it, death is cheap. It's all done. Life, if they have a limb cut off or, they're going to need a prosthetic and rehab and this, and they're going to lose money from the workforce and the contributing to the economy. I mean, I'm going in rapid motion talk here, but you put all these things together and you can see how you can get what are the sound bites they need to hear. You're saving taxpayers money in the long run by doing this stuff that doesn't have to, when they don't have insurance, all the hospital costs, that's going to be from you and I, taxpayers. That's going to come from the budget, et cetera, et cetera. You can see how after doing this for 30 years or so, I know the sound bites that are real. They're not fake, but these are real sound bites they need to hear. So you never know when you're going to need blood. You got to get that message out. I'll just show them my grotesque pics. And as Paul Pepe said, Dr. Pepe told us the other day, blood and TXA can help save cerebral outcomes. So we're reaching for the blood to do that. And here's a bunch of, here's the, what everyone wants to see, all the blood and guts. That's what we're trying to get. I wouldn't probably take these pictures to most legislators because you don't know how they're going to react, but you want to convey the message. Okay, anticipate your critics and preempt them. This I have some disagree with people, but I'm telling you, this is the method I use. I want to know what the arguments are. So I'll lay out it's a debate. I'll lay out my arguments. I want to know what my, for lack of better words, enemy, what is the problem? Is it blood shortages the problem? Is it supply in EMS? Is it funding? Is it FTEs? Is it, all the barriers that I'm not going to go over? I want to know that so I can think of the solution and convey that to the politician. And that's why I always, I want keep your enemies close by, whatever you want to call it. I want to know what their argument is so I can then nicely debate them and come up with a common solution. Positive, positive, positive. This is bad messaging when you ask for money and you don't tell them why. Good messaging is we all work 24/7, 365. We need your senator critical help. We need your critical help. We can maximize the odds that everyone in the state of Florida always gets the highest quality. You got to have those sound bites, highest quality care and most cost-effective care so you can have money in the budget to spend other places. I mean, there's ways to twist this around. You got to get those sound bites in there. Keep your cool. Don't cause a bloody political mess. Never attack, raid, insult the legislator, or disappoint you. You will likely need them another time. So what if you blow it now? You don't want to blow it forever. Or somebody else is going to have to do it. No matter how terribly they treat you, they can always, no matter how terribly you treat them, they can always treat you even worse. That was a typo, sorry, in the future. Work with around, everybody has an advocacy team. Okay, they may or may not get paid. Everyone can give you advice, no matter what organization you're with. So go to those sources to learn this stuff. And I'm still learning, trust me. I'm still asking people, how can I maneuver through this barrier or political obstacle, whatever. You need their knowledge. You need the advocacy team's knowledge of the legislative process, the many people involved, and the backstage that can be stressing up political maneuvering and negotiations that takes place. And trust me, if you don't think backstage political maneuvering takes place, you haven't done it yet. When I've been in rooms, the AED law we passed in 97, I'll go over it briefly. I remember the Speaker of the House, we were in a small room, me and a few other people, and he said, oh, I've already talked to John, who was going to oppose it, but he won't because I've already made a deal. And he's going to support me with this, and he's going to support this AED bill. That's how it works. If you don't know that, sorry to inform you, but that's how it works. Stay in your lane, okay? The politicians need your personal, professional, ethical credibility, authenticity, and stories. Don't be a gunslinger. I'm going to give you an example. In 2019 attestation, I was a gunslinger, but you better know what you're doing if you're going to be a gunslinger. Okay, I'll tell you that lesson coming up. These people work under a different operating paradigm. Learn the differences, how to maneuver through the bureaucracy. They are citizens first that later become legislators. Keep that in mind. They're citizens first. Later, they took this on. So keep in mind their calendars are chaotic, fast-paced, just like we do, everyone on this call, similar to what we do. So I like to tell the politicians, hey, great minds think alike. You're in chaos? Well, that's what I do for a living too, or did for a living before I retired. So there's ways you can relate to them. All states have to balance their budget. So keep in mind your grant for pre-hospital bud, if it's approved, may be shut down in the future unless you keep going over and over and reminding them, because they'll cut wherever they can to save the budget. Some states have paid staff, others don't. We're lucky in Florida, we have paid staff. There's always someone available that the legislator has a staff member you can call. Basic steps you can all do to improve the chances of all Florida obtaining pre-hospital blood. Be prepared, get involved for the right reasons, or get involved in this arena. When offered a window of opportunity, say yes, be willing to take strategic risk. You can take risk, but you have to weigh the benefits and the risks, just like we do for a living. Spread the credit for your successes, no matter how small. That's positive thinking. You want to pat everybody on the back so they'll do more. They'll be motivated to do more. Make collaborative friends longer. I can't tell you how many friends, including on this call right now, I've made during my path and career. Healthcare, let me see. Healthcare is shaped by politics at every level, from your EMS system to ED, to institutions to state, national, and global levels. Practice advocacy the same way you practice emergency medicine, and we all do this. We're diligent, we're compassionate, we like to spread our passion and enthusiasm. It's contagious. We'll do that in the political arena too. It'll be noticed. I'll tell you how it worked for me. Always tell the truth, always act your patient's best interest, and your patient, the state, and the nation's best interest. Above all, don't do harm. If you're going to do harm, you shouldn't be in this arena, just like you shouldn't be practicing medicine if you're going to do harm. Let's continue on. So I went from Emory, the staff with Corey Slovis and Keith Wren and all those people. Then I was lucky enough to go to emergency medicine in Jacksonville, whatever it's called now, Jack Shands or whatever was the U back then. Was lucky enough to be under some great mentors who taught me. It's not what they taught me, they taught me how to think. Okay, the visionary. How do they get stuff done? That's what I learned from all these great people, and that's what you should take advantage of. Don't get caught up in the minutia. Dave Vukic came from the Denver system when Denver was one of the best ER programs in the nation, along with Cincinnati, and he came from there and he mentored all of us. These were some of my fellow chief residents. You may know Mark Conorado, John McPherson. There's a picture of me. We were 3 of the 4 chief residents, so it was an awesome chief residency in Jacksonville, and we just fed off each other's knowledge and contagiousness and enthusiasm. It was a great 3 years. So during my residency, Beth Bruner was FCEP CEO, and she was wonderful to work with. She made us all go to Tallahassee and do emergency med days and take our little kits there and talk to the legislators from our own district and things like that. That was really the start of my advocacy, so I have to give her credit for doing that. Here's my ECC career. I was chair up in the Northeast when I was still in residency. Then I was in Palm Beach for a year. Sorry, Peter and Ken, I left you guys after a year. Flipped over to Tampa, became ECC chair for Florida, national ACLS chair, gave lectures all over, met all sorts of great people, really did some cool stuff. The AED law I'll talk about in a minute. ACLS experienced provider course. I collaborated with the Seattle group, which are pretty well known for their stuff, Richard Cummings and people like that, and we did great things, and they made me, lack of better words, being one of the contributing editors in the ACLS back in 2001. And then we did mass CPR We trained 8,000 people, trained on the same day in 2001, which was a record in one state in Florida. And guess who led that effort? This guy. And that was really the first time I collaborated with Paul on anything. So it was really an honor to learn from really the master of how to get things done. The AED, okay, the AED real quick, in 1997, that was my first legislation I was involved with. I represented Hart and Gus Bilirakis as a young Gus in Tallahassee. He was our sponsor, and so was Mike Fasano. And make a long story short, I was the one that testified up in Tallahassee. The senator wanted me to, I said, they're so simple and they're so safe, they're idiot proof. That's where I started coining idiot proof, which the media loved for about 15 years. And a senator said, well, if they're so safe, Dr. Sand, take off your shirt right now, put the pads on, I'll press the button. I go, I'm not going to do it in front of 100 people, but I'll go in that back room and do it. And he goes, no, you don't need to do that. We believe you. And it passed unanimously. So that opened up the floodgates. It gave good Samaritan protection is what it did to lay people. And that opened up the floodgates. And then American Heart brought me to Disney. And I met with the board of trustees and this guy, probably their most famous CEO, back in 2001. And what were we there for? To get Disney to put AEDs all over their property. And I didn't say Mike, I said, Mr. Eisner and esteemed board of trustees, let me tell you about these things. Number one, they're idiot proof. They're so simple. I held one up and showed how simple it was. And they're idiot proof. And then there was a case at Busch Gardens in Tampa. 13-year-old was on a roller coaster, died of sudden cardiac arrest, congenital defect. They didn't have AEDs, which had only been out like 2 or 3 years. Got sued successfully by the plaintiff. That was the landmark case to show why you need AEDs. That was one of the landmark cases. I brought that into the conversation and said, so Mr. Eisner, I know you have 5 cardiac arrests a month in Disney. This is your information, you know, beforehand. You have 5 a month. You know why you never see a cardiac arrest in Disney? They bring them underground in the tunnels. They don't, because no one can die in Disney. So they bring them underground, 5 arrests. I go, this is what happened at Busch Gardens. You're going to have lawsuit after lawsuit after lawsuit. It's standard of care. Within a day, they started getting AEDs, and here's the article. And what do they quote me on the idiot proof thing? That's all they cared about. And American Heart, I'll tell you this is where you go out on a limb and take a risk. They hated me using idiot proof. They go, you're telling everyone they're idiots. I said, that's the coin. That's the line that they're going to remember. They're so simple to use. They're not going to remember simple. They're going to remember idiot proof. And they did. And Disney now has them all over, and you get a map, look at your little map, you'll see where the AEDs are. And if you don't think I'm not proud, every time I go to Disney or on Disney cruise or anywhere in Disney, see AEDs, it's proud to have been a part of the team that convinced them to get AEDs. They're even on their cruise ships. Then we did the same. I collaborated with the Tampa Fire Rescue Chief Dennis Jones, who went to TIA, convinced them to get AEDs. They put 14 AEDs. Within the first year, they had 5 saves. They all came to St. Joe's, where I worked at. That's how I knew they come in talking. They didn't need to be intubated or anything like that. So this just fed my contagious behavior about my motivation to do it. Now they have like 60 or 70. There's Chief Jones. That's when the Super Bowl was here, or before the Lombardi. These are the guys, Joe Namey, Mark Swanson, who put me on the board, thankfully. And you got to understand, and this is my message, you should be part of your healthcare organizations, your medical societies. Those are good organizations. Don't get me wrong. Here's the problem. They all think the same way. They're doctors. They all think the same way. If you want to think differently, yeah, go get your MBA, go get your Master's of Public Health. That's nice. If you really want to learn how to do this, go on some of these organizations, get on the board if you can, or at least volunteer. American Heart was half healthcare providers, half non-healthcare. And you know who was the non-healthcare? CEOs of banks, CEOs of accounting firms, CEOs of law firms. And here's 2 examples. CEO of a place called Outback Steakhouse. You ever hear that? That's based in Tampa. They're on our board. And probably one of the, there's our board. Let me see which. Well, yeah, so I'll show you one really influential who did it. So here's my message about the craziness that I think I call it craziness, but what people told me, it's really showing my passion, dedication, enthusiasm for the good for humanity. That's my roadmap. That grabbed people's attention, mentors, politicians, and they're very eager to work with me and listen to me, collaborate, and teach me and mentor me. And that's what happened. And it's the craziness that pulled people in. Go Red in before I was on the board, I was president-elect, and Lisa Whidden, who's in Winter Haven Hospital, those who know her there, she's a big wig in the nurses administration now. She was the president then, and she was rolling out Go Red. She comes to me the day before and says, "We want to roll out Go Red, and I want to come out in a red dress." And I said, "Yeah, that's very nice, Lisa. You look very nice in a red dress." She goes, "No, that's not what I'm saying. I want you to wear the red dress and come out because you're the only one crazy enough that would do it." So what did I do? I dressed up. There it is, the American Heart Meeting 2004. But if you don't think this doesn't grab people's attention of your dedication to the cause, it did. And I had people like this. There was a little company called Home Shopping Network nearby in Tampa, and it was at the peak, their peak at that time. This was the reason. This was the CEO, Mindy Grossman. And there's all the stuff she's done since. She took me under her wings and said, "Charlie, you're a good ER doc, but this is what you need to do politically. This is what you need to do financially." If you don't, that's way beyond an MBA. That's way beyond anything to learn from these people because they're the visionaries. They're the ones who know how to do it. So that's where you want to know how I learned all this stuff, Peter? This is how I learned it. I'm not that smart. They just taught me this. So numerous achievement when we were on the board. This is all advocacy stuff. I'll go over a few things. Here's smoke free. I wasn't in this picture. That's Lisa in the red. There's our governor signing, Governor Bush. And our crowning, I'm going to spend a little time. I apologize. We started 5 minutes late, so I'm trying to go as fast as I can. Florida Stroke Act 2004. That's probably what I get the most recognition, which it was a team. It wasn't just me. So you got to understand, TPA came out in 96. From 2001 to 2003 or 4, we tried as hard as we could to get moving EMS to take stroke patients to the best center. There was something called geopolitical barriers where, for example, an ER doc or EMS doc worked for that hospital system, and the hospital system said, "You're not taking them somewhere else, or you're going to be fired from your job. We'll get somebody else." So if you don't think there weren't geopolitical pressures not to do this, you're wrong. We could not get through with it. I think I may have let me see what my next picture. Nope. So we had the leadership of Florida Association EMS medical directors. It was Rick Slavinsky was state EMS director. I had the West Coast. Tony Gandia had the South. And we were the leadership that really pushed a lot of these position papers and tried our hardest. It didn't work. So finally, I went to John Brennan, CEO. I was already president-elect. And I go, "John, I got an idea. I know nobody's ever done this in the country. Can we legislate this and mandate EMS to go?" And he said, "Sounds like a good idea. What do you need?" I go, "Well, you help me." And we calculated we need $100,000 to bring people. We brought my handpicked experts flew them to St. Pete. We met once a month to lay the ground. Remember, there was no template. We had to make this stuff up. How can we write a bill that meets all our needs? And let me go forward. These were our two. Again, you see Bilirakis, Fasano. They were our main. You got to have someone from the Senate. I should slow down. Someone from the Senate, someone from the House to be your sponsors. That's what you're going to need for a grant. Or not, you're not doing legislation, but you are doing legislation, but you're not doing a bill, but you're still going to need support. So you need the leadership support. And we did pass it. There I am in the picture, and that's Lisa Whidden in the red. That's our governor at the time, and he signed off mandating. Let me just tell you, I forget if I have it on the next slide, but we had all sorts of issues. Here's some of the geopolitical things that I had to face. This is your thick skin. I had ER docs saying, "We don't believe in TPA." I know it's hard to believe now, but back then, the ACEP was against TPA. I mean, it was all this pressure not to do this bill and support TPA because that was all that was available. Intervention was just starting back then. So I had docs come up to me and say, "Don't do it." I had docs come up to me and say, "My hospital system will fire me if we do this. You can't do this." And I said, "This is the greater good for everybody," and we did it, and we passed it. No financial support, unfunded mandate, which people didn't like, but you have to pass something if you want to make progress. We can readdress things. There was no registry. When did we address that? 2017, we got a registry. EMS did slowly support it. The mandate to become certified had financial implications. There was no site in. What we had was attestation. We had to do that to pass the first one. That was the political climate. I mean, Bill Arrakis told me, "Charlie, you don't have attestation in there. We politically cannot pass it." So we had to have attestation. That was the bottom line. Because it's easy to say, "Yeah, do all or nothing," then we would have had nothing. So we said, we'll readdress it in a few years. Little did I know, it'd be 2019. So we did the postmortem. You should do this on every time, good or bad, you have legislation. What went right? What went wrong? How can we do better? And stroke attestation, let's just get to the bottom part. And that was basically a CEO of the hospital can sign off and say, we're doing everything right. We don't need any inspections by a nationally certified organization. That was what attestation, for those who don't know. What the positive things that happened out of the Stroke Act, we were now the example, the template for everybody in the country. I got to speak, probably the most people I've ever spoken to. I think it was 10 or 15 or 20,000 people. I was a feature speaker on how we did it in Florida. Remember, there was no email, or it was just forming right now. I got calls all over. How did we do it? So we wrote up a little thing on some of the things we did. And all of a sudden everyone started coming on board. We wrote papers. We wrote papers of stroke system of cares, came out of that in 2007. And you'll notice some names, I'm sure you know. This was really cool. In 2010, the CDC came out with a whole summary of how we did it in Florida, and we all got interviewed for it. It was pretty cool. So there's a whole manuscript on that. So we continue to have successes, and you can see all the things. For time purposes, I'm not going to go over everything. But here's the thing. In 2017, we got a stroke registry with funding. Dr. 𝐒𝐭 May, rest in peace, was really the push behind that, with all of us helping him from all of our resources that we utilize, including politically. Florida Stroke Registry, now called the 𝐓𝐡𝐞 Stroke Registry, may rest in peace. So here's the point. Is this what we aim for in the future? Not all at once, but in the future with pre-hospital blood, a registry? The answer is yes. I know Peter's shaking his head yes, because that's the only way you can get data and look at outcomes and improve. And you got to have your sponsors. Don't read the writing. Just the purpose of this is show you got to have your main people. And Representative Magger will say, I think there was a stroke in her family, or she had a stroke, or her husband did. I can't remember exactly, but this is doing your homework, and find out who's going to be most passionate about this stuff. So there's little tricks you do. So look at what happened in 2018. These guys got fed up with attestation. They go, Charlie, can we just put some of these conferences together? And you can see what I talked about, the registry attestation. These other guys, I don't know their names, but they also spoke. And it takes a village. There's my village slide. And then in 2018, these guys came to me representing the interventionalists. Max Mokum was like president of the Interventional Society for the nation. He's a Tampa General. Ricardo Hanel's at Jacksonville Baptist, and he was part of the Dawn study. I'll just put it, so was Mike Frankel, by the way. That extended the window to 24 hours. So pretty potent people. They came to me and go, Charlie, this is ridiculous attestation. We're losing patients that should be coming to us to do intervention. We know you've been successful. Can you help us? And in my Forrest Gump, I did. So attestation versus, so we went through all the data. Ricardo and I were the main chairs of the committee. And basically we looked at all the data. The guidelines said you need to be certified. There was all sorts of evidence. We had all our ducks lined up to debate whoever needed to be debated against for attestation. We maneuvered through the legislation, political battles. I will tell you, this is a good story to tell. I got to be careful what I say on tape, but we had a healthcare provider, I'm not going to tell you who it was or where, who was employed by a large hospital system in Florida. I'm trying to be very vague, who was very resistant because you know why? That hospital system wanted to remain with attestation, so they didn't have to pay the money to have national certification. So he was convincing everyone he was the medical expert, which he was, not to vote for this. Let me see what my slide is. So I got two people. I did two tricks, if you call it that. Now I'm being a gunslinger. I'm telling you, don't do this unless you're ready to commit political suicide. So number one, this is not the political suicide part. I got Gus to call a certain very powerful governor at the time to talk to his Speaker of the House, Speaker of the Senate to get support to get rid of attestation. Then the other thing I did was I found out who that was. I found out who his donors were. I'm not going to tell you how I found out, although it's not hard to figure out. I called the three biggest donors he had, said, have you had a stroke in the family? One did, the other two didn't. If your mother had a stroke, where would you want to go? Certified center or not? We've shown with Florida Stroke Registry that it makes a difference. Studies have shown nationally it's making a difference. Boom, they talked to him, said, what are you doing not getting rid of attestation? Within 24 hours, he changed. He flipped 180. And we passed it after that. Whether this made a difference, I have no idea, because we rallied the troops, Florida Stroke Registry, West Central Florida, Broward Coalition, everybody, 𝐓𝐡𝐞, everybody called in to the local legislators. So I think it was just a massive blitz to make sure, because this had to be passed. It took too long to get rid of attestation, and we did it. And since then, I've done other things. I still work with Gus. Here's telemedicine in his Tarpon Springs office, and you'll see Gus on my left, Jerry Custon standing up in the blue, me talking to everybody across the ways, at that time, Senator Marco Rubio's staff. So we did some telemedicine legislation, which we're going to hit again. This is just last month at one of his fundraisers. He wanted me to speak about what? Stroke and AED and the accomplishments we did. And he got up, he said, I couldn't be more proud for what we did, not only in the state of Florida, but nationally, because it just disseminated after that. So, and I said, and he said, and Charlie, by the way, I want to hit telemedicine again and mental health again. So we're already working on some stuff, and I'll tell you how that went, because it does relate to the blood. And that's who Gus is. He's the most humble, bipartisan, up to a point right now, good friend of Trump. So it's nice to have good friends in high places. You can say what you want, but he's very good friends with them. So as far as if we did a bill federally for blood in EMS, and if it got to the president, it probably wouldn't be vetoed if Gus was one of our sponsors. So you see what I'm already thinking ahead. And Randy knows this, and some of the San Antonio, because I've emailed them what's transpired. They're the kings and queens in San Antonio, where it all started, as you know, and just lots of great people. And Eric did the first ground to EMS blood, and can't say enough good things about Randy, and just a wonderful person. It's really cool. My daughter lives in San Antonio, so she said it's only 45 minutes from where she lives. So we'll collaborate. Our wives and husbands and all that kind of stuff will meet up, and kids. So they've done, if you want to learn about reimbursement and barriers, just read these papers. They're way better than I could ever say. And Dr. Jenkins was nice enough to give me what they just did in Boston. Peter was part of that, probably other people. They're trying to do advocacy. It has all the template on things. I'm not going to even go over it because I can't do it and finish this up. I apologize. So whole blood, we're expanding access pre-hospital, pursuing grant money for pre-hospital blood products through advocacy. I've now joined because I've been pushed by my colleagues to do this, and I'm passionate about it, so I'm doing it. And we're collaborating with multiple people. And now, just telling you, I'm sorry this is so old information. 2 days ago, I was on the phone with Chief of Staff for Bilirakis and his main healthcare advisor, saying, here's what we want to do now. Here's where we need your help, Dr. Sand. Telehealth, mental health. I threw in community paramedicine. I threw in maybe AI, although they have some hesitation not to go into that. And guess what I threw in on Monday? What about federal pre-hospital blood bill? And they said right away, oh, Gus would definitely support that. And I go, can he be a co-sponsor? Because he's pretty powerful. Can we get him? And they said, let me talk to him and we'll get back to you. Let's see what's being done in the background. And I've already notified Randy and the San Antonio group, and we'll see where we go from this. I'm just planting the seed. We'll see where it goes. So I've already gone over this. I'm just going to fly through this. We have gone over all this. Here's the message. I'm trying to give you time, Peter. I apologize. We've already gone over all these points. It's a chess game. If I didn't go over that, you need to know where to put your pawn. You need to get the information. Don't be frustrated. Don't get angry. There's always an answer. And if you don't win, try again, as the old saying goes. Stay in your lane. Don't be a gunslinger, even though I was a gunslinger in 2019. But I think I was a gunslinger that knew what he was doing at that point. I weighed risks and benefits. Collaborate. You've heard all this. You can look at the tape. We've already gone over all this. And the opportunity to save lives happening every year, every month, every week, every day. This is why we do it for family. That's when my first and only still grandchild was born in June. That's yesterday at my house. They flew to Tampa, and I'm trying to visit them with whatever time I have left till they go back on Saturday, and I'll do it after this lecture. But that's my little grandchild. That's why we do it. The families you save may be your own. This is the message you got to get out. Do you want your mother to go to my kid's wedding in 5 years, Senator? Well, let's get blood on the street. If she gets in an accident or a GI bleed or whatever and needs blood, we can save their life. I mean, this is how you do it. This is not rocket science, but you got to do it this way. Thanks everybody. It takes a village, and I am out of there. And there's my email. That's it. Thank you. Sorry.
Wow. Charlie, that
Look
was
at the tape. Look at the tape. I went too fast.
so let me I'm gonna stop the share so we can then let's have a conversation now because I want to get a lot of people here involved. So I'll say, hold on a second. Charlie, can you just stop your share real quick?
Oh,
So
I apologize.
yeah, that's
Okay,
okay.
I see it. I see it. I see it. I'm sorry.
Okay, there you go. Perfect.
Did I
Oh,
do it right?
I have one quick question, which is, does Gus like 𝐲𝐸𝐲? What'd you think?
So, Paul, you know very well he loves Tarpon Springs, where he's from, which is a Greek village. And we took Dr. Pepe to meet. Gus couldn't make it, but his key administrative assistant, Jerry Custom, was there. And Paul knew everything on the menu, everything Greek.
And so the point is that part of it is knowing what, not about their children, knowing about
Right.
what's important to them, right?
Right.
Let alone
Yeah.
their background and their heritage, you know.
Yeah.
Thank you for saying that. Yeah.
So that's a great comment. So Charlie, you've had just a wonderful career, and I learned so many things about you today. What I've started to recognize though is that, you know, a lot of what you've done is you're personally passionate about it. And then you, as you say, Forrest Gump, you kind of ended up at the right place at the right time.
Absolutely. Over and over, over and over.
Right. But then you kind of recognize that being at the right place at the right time with the right people, and then you can elevate your
Right.
ability to help others without being at the bedside per se. Right.
Exactly. Yep.
And now you've had the ability to and listen, I could tell you from a personal situation that the attestation aspect, it ended up being something that I wish the hospital at the time when my grandfather went there was a certified hospital because they had attested to something that they couldn't really perform. But you moved on from the attestation, you got the certification, and I can tell you, because as you know, we just published this, but there's thousands and thousands of patients who have stroke here every year in the state of Florida who are getting much better care because of the advocacy efforts that you put through, right? So from all of us, and I know I see Dr. Gandia, and I would love for Tony to come on and say a couple of words because I know you had him on a couple of the slides.
I'm going to say one thing. When you're done, I'm going to say one thing real quick, Peter.
Yeah.
Well,
So,
okay.
No, go ahead. Go ahead.
No. First of all, thank you, but it is a village. It's multiple people. I could not do this alone. And American Heart was the machine that put me in the position, and then I took it from there. But just real quick, I didn't harp on this. If you can't do it, if you don't want to do it, support the people that do it. And I will give my credit to my group EMA in Tampa at St. Joe's and St. Joe's hospitals. They would let me now as medical director, and I did disaster and all that stuff. I was able to go from like 16 shifts to 8 to 10 a month and be able to do all this stuff on top of everything else. So my point is support your colleagues who are doing it. Sorry, go ahead.
Okay, so now that we've kind of set the stage, now we have an ask here. For people who have been following, everybody knows that we have an amazing Deputy Secretary of Health for the state of Florida. His name is Dr. Ken 𝐤𝐿. Ken is an EM physician, EMS medical director, and he's fighting for all of us. He's fighting for every human being in the state of Florida, and he's working towards now getting legislation passed by the governor. That legislation is not going to be passed unless every legislator gets that signal that this proposal has meaning and has merit. So this is a perfect opportunity, Charlie, if you want to talk about this, for every person who doesn't have the years of experience that you have, but
right.
your kind of steps for success include showing up to their office, right. Writing a letter, which is probably less effective, making a phone call, but
invite them.
Right. So every single county in this state, we have EMS medical direction, right? We have nurses, we have doctors, we have people on this call.
Right.
What should they do? And of course, we're going to help them do this, but what are the steps that they should take if it's only one step?
Yeah.
As far as getting this bill past the finish line,
right.
which is going to happen the next session if
right.
it all works out.
Okay. A couple steps. Number one, especially if you're a novice, and I hate to say it that way, but most of us, I started out a novice too, is you need the bullet points. So you guys, meaning all of us, the leadership, need to make those bullet points on what needs to be said. Harping the cost effectiveness, the economy, save the budget, save taxpayer money, all the coin words that you need to say. Save a life, including Senator, your mother, maybe, or your wife someday, so you can, or your daughter, so you can be married and go to college. So that's the bullet points. Then they need to call their legislator, especially now being the next before January. Watch the holidays though, because everything shuts down after Thanksgiving. So somewhere between now and Thanksgiving, they need to meet with their local legislator in their office, say, this is what we're trying to do. And by the way, Representative, I work in this ER or this EMS system or this EMS training program. I would love for you to come by and we will show you all the great things we're doing for your community that are your voters that will reelect you. I mean, you don't quite say it like that, but you imply it. And they know that. And that's how you do it. And you're saving lives, you're saving limbs, you're saving costs, and you're getting their vote for the next election. That's the bullet points right there. But does that answer your question?
Yeah, so I'm gonna actually give a perfect example because you're going to what there was a point I wanted to make. I got an email 2 days ago from somebody in Missouri who kind of did this, but he did it in a way of just like, hey, Senator, we want to do blood in the state.
Yeah.
And he got a response back from an assistant. Okay. And it was here's what they wrote. I'm not going to read you the whole email, but she says to the chief, as a chief, since we spoke, I reached out to our public safety contacts for any feedback on this potential requirement. Ultimately, all believe that this would burden a system that is already at a critical or emergency shortage in blood supply.
Yeah.
So he wasn't really prepared for,
Right.
like you said, the objections,
Yeah.
right?
Right.
And immediately they just shut him down, an assistant shut him down, and now he's got to go now and fight, claw his way back into the office again. So now comment on that if you will.
That's the gunslinger. That's the cowboy cowgirl. You can't do this on your own. You got to do a unified approach, and you have to be prepared. I can't tell you. I'm just making this up. For the Stroke Act, I probably put in 1,000 hours. I can't tell you how many hours of preparation to get to that point where I knew every argument, every debate that would come up with my colleagues, with everybody, and I was able to handle it again with other people's help. But it's preparation, and unified attack. It's a unified attack's not a good word. Unified ask.
Yeah, and we are going to do that through the chapter. Dr. Pepe, go ahead.
So I what Charlie's saying is absolutely right. You've got to get the bullet points, but you got to also get it by the right people. But one of the ways that we've always learned, one of my favorite rules is that questions attract, statements repel. So part of it, if you're making the elevator pitch, or even if you're sending a note in, what if I can tell you that regardless of age, gender, socioeconomic status, we could make Florida urban or rural the safest state for a 14-year-old daughter, as you were just saying, right, Charlie, to survive a life-threatening car crash, or save many children attacked by an active shooter, or an innocent 5-year-old for falling victim to an accident with severe hemorrhage. And so just leave it at that. Is then what if I told you that accomplishment is absolutely within our reach right now? So that sounds good. They're going to want to know what it is, what the answer is going to be, and we'll try to tell them that. But I think that we've already had great successes within the state, but we got to make it a statewide thing, and we need it in your district as well. Correct? Does that sound right, Charlie? Or
it doesn't sound right. It is right.
Okay.
All right.
No,
So
I'm serious. It has to be. This has to be just so well planned, and then give people the information and tell them what you want them to do, and then how you want them to call the office of the senator and speak to him to make an appointment, bring him to your I mean, all those steps that are bread and butter to you, Paul, me, Ken, Angus, everybody else. We know these steps, but we got to get with the 5 of us or 6 of us can't do all this.
So I'm going to spring board off what Dr. Pepe just said, because I recently had an experience up in Washington, D.C., where I went with a bunch of neurointerventionalists, smart people. They were prepared with the bullet points and the whole thing. And we went from senator's office to Senate. We saw maybe 20 some odd senators. We saw their assistants, right?
Right.
And as soon as they get in there, these people read you in 3 seconds. What they really want to know is, is there language already written that you need us to support?
Right.
If you come in there with just hey, we really hope that, no, like, So the benefit and the beauty of this process that we're about to embark on, all of us, right, is that the language has already been submitted. It's already sitting in there as a very high priority.
Yeah.
So like us walking in and saying, here's what we need. And by the way, the language is already there. All we
Yeah.
need for you to do is give the thumbs up is that's the beauty of this whole process.
That's right. They want to say they don't need any more work. They're already hit by stuff. You say,
Right,
here you go.
exactly.
It's packaged. We have actually on the call one of the greatest advocates nationally, for us all. And Randy Schaefer, Dr. Schaefer, anything you would add to what we're saying here?
Let me actually give the ability to unmute and to start video.
Oh,
Go ahead.
Yeah.
Lieutenant Colonel. There she is.
Yeah, I think it's a great point, Peter from Missouri. So we're gonna have to do a little cleanup now. But
Clean up on aisle 5.
no, it's okay, because who does that office need to hear from? I've got 2 CEOs of blood centers now lined up, ready to go talk to that person. So, a little bit of background about that was it was somebody in the legislator's office who had a little bit of background, who all they see are these cries for blood donations on TV. And we're like, well, no, this doesn't sound good. So yeah, know who your stakeholders are, a unified front. So anytime we go talk, we make sure we have EMS, hospital, and the blood centers going
Yeah.
in lockstep, arm in arm.
But what she is saying about hospitals is important too, because we now have the data and make sure we have the right hospitals, have the data that say it's saved us a lot of transfusions by doing this. This program actually,
Right.
had an
Yes.
economic, and it saved us blood transfusion. So we love this because we don't have to give as many. It saves a precious resource, right? So
If I could just say, I thank Randy. Randy, I think you realize this. We talked, I think on Friday, I talked to Bill Arrakis's main people on Monday, and don't think I didn't utilize some of your bullet points when I was talking to them. And I wouldn't have been able to make the ask right there if you hadn't gotten me ready, and other people too, but you especially. So thank you.
And now, thank you so much. So Randy, stick around because we don't want you to go away, but I want to bring in Dr. Tony Gandia.
Yeah.
Tony has been around with us for many, many years. He spoke at the dinner the other night, and I know that you wanted to say a couple of words. So
Yeah, a couple of things. And again, thank you. And Charlie, thank you so much. And I've taken this ride with Charlie for about 30 years. And truthfully, we didn't know what the hell we were doing at the beginning. But what we did know is that we needed each other. Truthfully, he started it at the West Coast, and we kind of attacked the East Coast. And really, obviously there's power in numbers, of course. And that's what we try to do as best we can. I think one of the other important points is that getting the stakeholders as well. I think that the way we attacked it, we did the EMS medical directors. Actually, I was president at that time, and we had those 2 quick position statements, pretty much saying that strokes and STEMIs need to go to the right place. So that was kind of helpful. With that, we had the Fire Chiefs Association. We added the Broward Medical Association. Charlie did his West Coast folks. So then when we spoke to these legislatures, we said, hey, by the way, these folks here, this whole line of people also endorsed the product. So that was they kind of listened to that then, because it wasn't just us, it was these other stakeholders that also endorsed that product. So I think that was important.
hey, Tony, quick question, but isn't sort of the opposite a little bit true as well, as like knowing, is there opposition out there? Who's the opposition? And can we therefore anticipate what that might be and have an answer to that?
Absolutely.
Yeah, just like the lawyers do, right? Don't ask a question that you don't know the answer to, right? So really that's very important as well. And Charlie mentioned that we need to know, what these folks are feeling, etc. So I think, getting stakeholders to really support the product even before we go to the legislatures and say, hey, by the way, these are the folks that support that. With the bill at the station, one of the things that we realized was under 64J, the EMS and fire stuff, it said, people need to go to the closest facility. Now, it took us a little while because
Yeah.
just a change in that one sentence that changed to the closest, most appropriate facility really changed the landscape tremendously for us,
Yeah.
because now hospitals didn't say, well, they're going to come here no matter what. We said, you
Right.
know what? No, we think this hospital 5 minutes down the road, 10 minutes down the road is most appropriate. And that really changed our landscape. So that simple change in sentence in 64J made a big difference to us as well. So I think the key is, the stakeholders, the things we can change. And most importantly, a couple of us have noticed that is, now is the time to reach out to these folks, because once they're in session, they're all over the place. It's hard to grab them. Now that they're in town, et cetera, it's really the time to grab these folks.
Excellent. Dr. Getting a great commentary. Thank you so much for all the work you've put in over the years. I do want to bring back in Dr. Schaefer again. So, Randy, we have to give credit where credit is due with the state of Texas. They really prompted us to do what we're doing here, and Dr. Shepke to do what he did. If you can say a couple of words about how you all got the state of Texas to do this, reflect on some of the things that Charlie has mentioned today, and then look into your crystal ball for us. And do you think that what Texas has done, what Florida is going to do you think that this is a model of what we can do for the rest of the country? And then to Charlie's other point, do you think this becomes federal one day? A lot of questions in there.
Yes. So first, I had nothing to do with the Texas legislative piece. That is all Don Jenkins and Emily Kidd and who else? CJ Winkler went to open mic night at one of the Eric Bank calls open mic night, and had about 2 minutes to make their case, to the finance committee of why they should bring this up. They made it a relatable story. Interesting. One of the legislators was looking at MVC deaths in his district and trying to how to improve traffic, fatalities. So this data spoke to him, right? It wasn't the penetrating trauma. It wasn't, the GI bleeds. He had a problem with people dying in motor vehicle crashes. So yes, I think you can from the state level. I also advocate that this should go under disaster preparedness, disaster response. We tend to think about the eaches of the patients, but we need to start thinking more from a systemic plan. And I think the state is the right level to do that. And yes, this should be at the federal. We've made headway with CMS, the Pre-Hospital Blood Transfusion Coalition, by recognizing that pre-hospital blood is a life-saving intervention under ALS 2. And that was done through showing some data, having conversations. It was unfunded, but the fact in about 6 months we got CMS to recognize it is Operation Warp Speed.
Yeah.
Now we're going to approach some of the legislators to try to get some of the funding behind some of the initiatives we're doing. Where CMS goes, the private payers go, and we're also working at state level for the states that do have state insurance. Not sure what the technical term is for that.
And I'll just answer real quick, Peter. The Charlie saying answer is absolutely it should and can be federal. And Randy knows this, and I'm just waiting now for advice. I've already planted the seed, and I'm just waiting where Randy wants me to collaborate. Randy's my boss now, so she tells me where to collaborate legislatively, and I think we can get it done. Just talking with Gus's office, and he is very in the know and very powerful, for lack of better words, and get things done. They will advise me, but now we're at the point where we need to have bullet points, for lack of better words.
Randy, I want to ask you a quick question, getting back to my point about what's the opposition, so we can anticipate, so we can go, I know but, and then we could say, here's how you refute that. So what are the things that you're seeing across the country, and what do you think we might see in Florida?
So remember looking at each of your stakeholders and figure out, yes, you have the pro camp within those stakeholders, but you also have the opposition camp within the stakeholders. So some of the hospitals don't want to participate in taking blood back, helping be part of the rotation. We still have hospital systems out there that believe EMS just needs to get the patient to them. So sometimes those are powerful voices within a hospital. On the pre-hospital side, we've got EMS medical directors out there across the country who don't believe this is a real thing. It's just a fad. It's going to go away. They were waiting for the prospective randomized controlled trial to prove that this works.
Oh yeah.
And then on the blood side, I just had the opportunity to present to a large chunk of the CEOs for the Blood Centers of America. And my first slide was the picture of Braveheart, you know, when they're all attacking.
Yeah.
And I said, this must be how it feels with EMS coming out of the woodwork, beating you guys up that everybody wants this. And they're like, oh my God, yeah, you get it. So I said, EMS should not be approaching you unless they've done their due diligence and they're doing some data guided, data informed, because not every EMS agency should be carrying this capability. So that's
To
kind of
that
how I
point.
attack it, is knowing who my stakeholders are, but understanding the pro and the cons in each camp.
Yep.
Make my battle.
Right, and Paul and Charlie and Randy, we're gonna need all of you guys with all the experience to help everyone in Florida to kind of make the case, to know who the objectors are. And to your point about the hospital voice, you know, the state of Florida has tried to pass 2 years in a row that hospitals need to become pediatric ready. Simple, right? Like, we want more children to stay alive. It was blocked twice. It was blocked twice. And
It's
only
stroke. That's a stroke act all over again.
right. And only 14% of hospitals in this country are pediatric ready.
Yep.
And there's thousands of kids dying because of errors. But the hospital says, oh, well, that's going to cost me money. Therefore, you know, they have the lobbyists. So I think with blood, we have an easier path. But it is true that, and you can correct me if I'm wrong, but several hospitals see pre-hospital blood as, oh, I have to give less blood, therefore less money. These patients are less sick, less money, less ICU days, less money, less intubation days, less money. So there is a business case to sicker patients in America today, where that is not the way we look at it through our lens in EMS. And so we also have to remember that different people, non-medical, non-clinical people, look at the sick trauma patient, the sick medical patient, very differently than we do in EMS. As Paul said, you give a unit of blood, you may save 10 units downstream. That's good for 90% of us, and 10% may not like that. So we have to understand the financials and the economics of healthcare to really understand our audience as we're talking to non-clinical people. Do you agree with that? You or Paul? I'd love to hear a comment, or Charlie.
100%.
Yes. Yes, from me. Go ahead, Paul or Randy.
Randy.
Yeah, and that part of our strategy, you know, on the national coalition is, you know, CMS is a big payer, but CMS also hands out penalties to hospitals when their patients are getting hospital-acquired infections, all of these other metrics. So if I can keep a patient in the ICU for fewer days and bring them in better resuscitated, draw the lines for them that, hey, okay, we're going to help some of these downstream issues for you.
Yeah.
Literally,
I'll
figuratively.
just say, no, if I could say that, I had a slide on carrots and sticks and I was going to use it. I didn't use half my slides because I knew how long it would be, but that's a good point. I had a carrot and stick slide.
Yeah.
Getting back to who the opponents are, you really need to understand the lobbyists. Like I'm thinking, which lobbyists, what were they lobbying about when we try to block the PD readiness, right? So for example, I'm talking about, geez, must be almost 40 years ago, maybe, I don't know, 35, 40 years ago, I had legislation passed in Texas to actually, it was called, I was fortunate to actually, of all things, to work with the NRA, and we called it a gun responsibility law. We had started off with a municipal ordinance, and they said, hey, we don't want any more gun control. These are irresponsible gun owners. So we agreed on the language so that's the important issue, is the language of a gun responsibility ordinance, which passed, and we actually literally saved a lot of lives. We were able to document that. When I went to the state, it was still being obstructed somewhere in some committee, and we were going, well, why are they against us? We have data and everything. But then we found out it was the gun manufacturers who are involved there. So part of it is, see, I thought the NRA was on my side, and so therefore we've got it all set, right? And so it was kind of an interesting thing. And have you had experience with that, Charlie, in some of the epics that you've been involved with?
I'm trying, Paul, I'm trying to follow your
Yeah, I'm
thought.
trying to say is that you might be surprised that our lobbyists there, that you thought the main lobbyist, like for example, in my case was the NRA, but it wasn't. It was the gun
Oh,
manufacturers
no, that's
and the
exactly what
stuff behind the scenes, right?
no, that's what I say. You have to do your homework. You have to use every resource you have to find what all the arguments are so you don't get blindsided. So absolutely, I agree. I don't know how, and then when you get caught by surprise, there's nobody better than us in the ER and EMS at just making decisions on the fly. And that's I'll be honest, I didn't put this in. I think I might have had a slide. That's why I think we're so valuable politically. If we desire to do it, we can think on the fly and just move quick in this chaos. So yeah, I agree.
It may go to some committees. We need to know who's on those committees to make
Oh
sure
yeah, I did. I had
our
slides, Paul.
justice.
I couldn't include. You need to know who chairs the committees, who's their constituents. Get those EMS directors and EMS people to call in to those or meet with them. Yeah, absolutely. It has to be. You can't. You can blitz everybody, but you have to blitz the key players. Absolutely.
The nice thing about this, and these are all amazing points, but I think that this is going to be in the governor's budget. So I don't think this is going to have to go through that whole, all the bowels, maybe just the, maybe just the, duodenum. I don't know. I don't know how it's going to work, but I think it's going to be a little bit better. So we're getting up and we're already past time, but I do want to get some next steps here. And what I would propose is that we have a series of working meetings coming up next, to document and create the language, the one pager, if you will. Second is to have a spreadsheet of at least Florida chapter member of NAMSP and who your representatives are. And then, we'll give you their addresses, we'll give you their phone numbers, we'll give you their emails. Heck, we'll even help you write the letter. But what we would like for you to do is like Paul has said, like Charlie said, Randy said, just like go there, knock on their door, set a meeting. You'll speak to an aide. You probably won't. I mean, Charlie, am I right, Paul? Even here locally, you're probably not going to see the rep. Is that true?
The what? See the legislator, you mean?
Yeah.
That is, well, locally, if you strategize it and you plan it right and you say who you are, so and so, especially if you're a director, if you're an EMS or a medical director, if you're in a position of power or leadership, you probably will see them locally. I can tell you that. Yeah, you just got to plan it. They'll make time if they know you're a voting constituent of theirs. They'll make.
Yeah. So that's the thing, is a lot of times I would invite them to, like, that's why I make the joke about being the Harbor Beach Homeowners Association. Well, come and speak to us, that kind of thing about, whatever it is. And, or you can even pose what you want them to talk about. And we can help you out with that. Because there's a concern amongst our folks, and whatever it is, you can invite them to a public session of something or other where you're doing it, and they can all say, even if they just stay for 5 minutes, but you're plugged in with them, so to speak, right? So
yeah, well, perfect. And Paul, maybe we ought to think about for Eagles in June, because it's going to be, if this goes through, folks, it's going to happen in the summer of 2026. So
yeah.
We all have to work hard, and maybe it's a celebration during Eagles this year of the big Florida law being passed.
Oh yeah, and I'm going to even now take it to the next level. I'm going to bring in about 4 or 5 state surgeon generals or state health directors, whatever, but will be there with us, just as we had last year.
Right. So. And we have like a blood donation drive at the conference. But
correct.
Well, Charlie, Dr. Sand, this has been a masterclass. I think a lot of people are sticking around because I think like me, they found it so fascinating that all of these stories are important to tell. The way that you've told the stories, what you've done in your career. I know that you're retired, but
I'm
just
not
like
retired.
Tom DiBernardo, we're pulling you out of retirement.
There's too much fun, Paul. No, Peter, there's too much fun. It's fun.
Right.
If I'm having fun, I'll do it, and I'm available. This is not a one-shot deal. Anyone who wants to connect with me, I'm happy to. If I can give advice, I will. I'll put it that way.
Thank you so much. And you're getting a lot of love from Glenn Davis and other folks on the call who are giving you the emoji. So we appreciate you. I'll stay in contact with you, Charlie. Of course, Dr. Pepe, a huge mentor of mine. We will strategize about how to help all the folks in Florida connect with their representatives. So stay tuned for that. And if we do have to drive up to Tallahassee and make a presentation, we're ready to do that as well. So I appreciate everybody. Thanks for joining today, and thanks for spending some time with us today. Dr. Sand, have a great day.
Thanks.
Thank you so much.
Thanks for volunteering me to do it.
Yes, absolutely.
Yeah, and Charlie,
Randy,
thanks
thank you.
for bringing us Life is Like a Box of Chocolates. Okay, so
Well, I knew you were a chocolate lover, Paul.
yeah. All right.
Bye, Paul. Thank you, Randy. Thank you. Thanks everyone for joining today. Appreciate you guys.
Thanks. All right, take care. Have a good
Onward and upward. Thanks. Bye-bye.